Mr. Roy, you're recognized.
Notice the ranking member says that, quote, we own this.
You do.
If we don't go down the road that is being suggested here before us, when in fact, the current situation with respect to health care exists entirely by record of vote and record of policies as a result of my Democrat colleagues putting forward the policies that the American people are having to live under. Entirely. They broke the system, and then they come here saying that we own it if we don't throw more subsidies, pour more diesel on the fire to the fire that they started. That's what's happening right now. That's what for the American people to understand. Insurance companies.
Bail out Argentina.
Insurance companies, 1,032% stock prices up since 2010. 448% up from 2013. 85% of the revenues for insurers come from the federal government. What my Democratic colleagues are proposing is an insurance company enrichment scheme.
All right, let's pause it right there. What you just heard from Congressman Chip Roy was not political theater. That was frustration, backed by numbers, backed by lived experience, and aimed directly at a system that has failed everyday Americans while pretending to help them. Because here's the truth, when someone stands up and says, we broke this system, and then demands more of the same policies that broke it, that's not accountability. That's deflection. Chip Roy wasn't hedging. He wasn't soft-pedaling. He laid out a blunt argument that most politicians are too afraid to make out loud. The U.S. healthcare system didn't collapse by accident. It was built this way through deliberate policy choices, and those choices overwhelmingly came from one side of the aisle. Before we get into the full exchange and break down exactly what Roy is saying and why it matters, make sure you support Capital Clarity by liking this video, subscribing to the channel, and sharing this with someone who's tired of scripted outrage and wants straight talk backed by facts. Now let's watch the rest of the video. And after that, we'll get into the real reaction. Now that
Mr. Roy, you're recognized.
Notice the ranking member says that, quote, we own this.
You do.
If we don't go down the road that is being suggested here before us, when in fact, the current situation with respect to health care exists entirely by record of vote and record of policies as a result of my Democrat colleagues putting forward the policies that the American people are having to live under. Entirely. They broke the system, and then they come here saying that we own it if we don't throw more subsidies, pour more diesel on the fire to the fire that they started. That's what's happening right now. That's what for the American people to understand. Insurance companies.
Bail out Argentina.
Insurance companies, 1,032% stock prices up since 2010. 448% up from 2013. 85% of the revenues for insurers come from the federal government. What my Democratic colleagues are proposing is an insurance company enrichment scheme. It's literally what they're doing, is printing money in the Treasury and giving it to insurance companies. That's their solution for health care. Enriching insurance companies that are the very people that are telling the American people which care they can get and not get. There's no chance for an American to go to the doctor of his or her choice. There's no chance for them to go get care. There was no chance for my constituent who lives near Fredericksburg, Texas, to go to MD Anderson to get care because she's on Obamacare, which can't go to MD Anderson. And if the cancer that I had when I went to MD Anderson came back and I'm on Obamacare as a member of Congress, I couldn't go to MD Anderson because of the situation that my Democratic colleagues have put the American people in. Going around and preening that you're somehow caring for people more by giving them coverage for care that doesn't actually provide them care, while insurance companies get rich. $35 billion in subsidies in 2024 for people who didn't even use their plan. It's absolutely unconscionable. That is right. That is the correct word. It is unconscionable what we have done to the healthcare system, destroying it for the American people so that they can't get the care of their choice. That's what's happened. And now you hold the government hostage for 45 days and then try to come lecture Republicans about it when you've been holding the American people hostage to a broken healthcare system for 15 years. That's what's been going on. The fact is, Madam Chairman or Chairwoman, we are here today trying to proceed with, I think, reason, with 3 appropriations bills combined with a continuing resolution through January. After having tried with reason to fund the government through November 20th so that we can continue the debate on the various issues in question. But our Democrat colleagues refused to do it. And so now we've got the opportunity in front of us to extend, fund government at current levels, roughly flat, trying to stave off the inflation that is the direct consequence of the massive amount of government funding that has been going on by both sides of the aisle, but heavily being promoted from my colleagues here on the other side of the aisle, who want us to throw another $1.5 trillion at it. That's literally what they were saying. It's not a solution. That's just printing more money while trying to go run campaign ads while you shut the government down for very clearly and obviously political purposes. I yield back, Madam Chairman.
Madam Chair, I wish the gentleman had that passion condemning the $40 billion bailout of Argentina, the right-wing cuckoo clock in Argentina. I wish he had the passion to condemn that.
Mr. McGovern and Ms. Scanlon, you're recognized.
Action. Now that you've seen the whole exchange, let's be very clear about what happened here. Chip Roy did something most members of Congress avoid at all costs. He refused to accept a false premise. The ranking member tried to frame the debate by saying, "We own this," implying Republicans will be to blame if they don't go along with more subsidies, more spending, and more government intervention. Roy immediately dismantled that framing. And he was absolutely right to do so. The current healthcare landscape didn't emerge out of nowhere. It emerged from votes. It emerged from policies. It emerged from Obamacare and the regulatory structure that followed it. You cannot set a house on fire, watch it burn for 15 years, and then accuse someone else of arson because they refuse to add gasoline. Roy's argument cut straight to the heart of the issue. Modern healthcare policy has stopped being about patients and started being about insurers. Look at the numbers he cited. Insurance company stock prices skyrocketing. The overwhelming majority of insurer revenue coming directly from the federal government. Tens of billions in subsidies paid out for coverage that people never even used. That's not a safety net. That's a transfer of taxpayer wealth to corporate middlemen. And this is where Roy's point becomes almost impossible to refute. Coverage is not care. Politicians love to brag about how many people are covered. But what good is coverage if you can't choose your doctor? What good is coverage if you can't access top-tier hospitals? What good is coverage if bureaucrats and insurance networks decide where you're allowed to go when your life is on the line? Roy's MD Anderson example isn't abstract. It's visceral. When cancer doesn't wait, when treatment windows are narrow, when outcomes depend on specialists, being told your plan doesn't allow that is not compassion. It's cruelty disguised as policy. And let's talk about the moral clarity he brings when he calls this unconscionable. That word matters. He's not saying the system is inefficient. He's not saying it needs tweaks. He's saying it is morally wrong to destroy patient choice while enriching corporations and then pat yourself on the back for it. Now layer that over the government funding fight. Roy points out the hypocrisy perfectly. Democrats hold the government hostage through shutdown threats, refuse short-term funding extensions, and then accuse Republicans of recklessness. At the same time, they demand another $1.5 trillion in spending as if inflation is some mysterious force instead of the predictable outcome of non-stop money printing. Flat funding. Continuing resolutions. Extending debate timelines. These are not radical positions. They're attempts at restraint in a system addicted to excess. And the most telling part of the exchange comes at the end, when Roy is lectured about passion for issues unrelated to the actual debate at hand. That deflection proves his point. When you can't rebut the argument, you change the subject. Chip Roy didn't just make a political speech. He delivered an indictment of a system that rewards compliance, enriches insiders, and leaves patients with fewer choices and fewer options. Whether you agree with him or not, one thing is undeniable: this is what it looks like when someone refuses to play along with a broken script. And that's exactly why moments like this matter. Because clarity, not chaos, is how you fix what's been broken. This is Capital Clarity.